And joining me now, I'm pleased to introduce Vicki Kaminski, the interim CEO and president of Muskoka Algonquin Healthcare. Vicki, really appreciate you taking the time today to talk to our viewers.
Oh, thanks very much, James. It's a pleasure to be here and nice to meet you, at least virtually.
Yes, virtually finally get to meet. And Vicki, just wanted to first of all kick off things by, welcoming you to this role. I've heard good things, and I obviously, the board wouldn't have chosen you if you didn't fit the role perfectly. But I did want to hear a bit about your background. I know that you are I guess you would say semi-retired at this point since you've come back into this appointed role, but what is your background in this profession?
So professionally, I trained as a nurse and I actually still maintain my registration with the Ontario College of Nurses, although I have to say that every time I say that, it's in a non-practicing role. So I no longer can practice nursing, but I can be a registered nurse. So that's where I started, and I went on. I did a master's in an MBA actually in business administration in international business, and but I've worked in hospitals since 1975. I graduated nursing in 75, and I've worked in hospitals and in healthcare since that time, and been very fortunate in my career. I've had lots of great opportunities. Worked for most of that time up until 2009 in Ontario, in Northern Ontario in Sudbury, and then moved and went to Newfoundland and worked for the Eastern Regional Health Authority in Newfoundland as president and CEO. Did that for about 5 years and then moved to Alberta and took on the role of president and CEO of Alberta Health Services, which was a huge challenge. I mean, they had 110,000 employees, and we had a $14 billion budget. So same issues that we had everywhere else in the system, just magnified tenfold in Alberta for sure. While I was in Alberta, I got a call from Australia. They were looking for someone to come and help them with transformation. And I was ready for a change. So went to South Australia as the lead for their health transformation, but wasn't there very long before they asked me to be the Deputy Minister of Health. So I did that in Australia, and when I finished that in July of 2018, we moved back to Canada, and I said I'm retired.
What attracted you to come back and take over this interim position?
So I finished up with the Winnipeg Regional Health Authority actually in May of 2021, and we moved back to Sudbury. And at that point, I had decided I really was going to retire. But when I got the call about this opportunity, it was very appealing. Muskoka is just a wonderful place. The Muskoka Algonquin Health Centre has a great reputation in the province, and it was the kind of opportunity, and I'm looking at a team of people here who have worked so hard for so long, and they just are really making a big difference here. So it was easy to say that's appealing, and that would be a great place to spend a few months and come in and just help them out while they deal with COVID and while they get a new CEO in place.
What, being that it is an interim position, what do you have any goals in mind while you're here other than, obviously trying to keep the ship moving on? How do you foresee yourself moving forward in this position as you are in it?
Well, I'm going to try to be a help and not a hindrance. I said to the senior team, I'm really going to try very hard not to make your life more difficult than it already is. So tell me how I can help with that. The board also had a couple of things that they'd like me to do. So use this opportunity to take a look at where we're sitting financially. And Natalie left us in great shape, I have to say. I've never seen a hospital with positive variance the way ours is. So kudos to her and her team, and looking at what does that mean for us going forward? Where should we be thinking about investment? And also to look at just some of the opportunities that we might have as an organization to look at our models of care and to make sure that we are as up to date as we should be with the rest of Canada in our models of care.
At the MAC hospitals right now, as I understand, we between hospitals have 10 COVID-19 patients that are, reported in these hospitals, and we recently had this outbreak reported in Huntsville Hospital. Where are we at right now with this, Vicki? How are things looking as these numbers locally go up? We're at the highest point, I think, of COVID patients we've had in this entire pandemic in these two hospitals.
You're right. We do have 10 patients. That's the most we've ever had through this whole COVID experience. And we're likely to get more. We're seeing lots of patients arriving in our eMERGE with COVID. And we also have had an outbreak. The one in Bracebridge has resolved itself. Excuse me. But the one here in Huntsville is still underway. Staff are managing admirably, I will say.
We're into this Omicron variant stuff. As mentioned, we're at the highest amount of COVID-19 patients in our local hospitals. How are staff doing right now?
You know, in spite of all of that, they are doing a remarkable job. They're really tired. They've been in this for a long time. I was coming in early one morning last week and met one of the nurses who was going off night shift. And she stopped me in the parking lot and she said, the only way we can tell who's coming and going are by the marks on our face. So she'd had her mask on for that whole period of time and I was just putting mine on. And she said, that's how we know if we've worked nights or not. And that's the kind of staff response that we're getting. I mean, they're here, they are working hard and they are working to keep it as safe as they can. It would be nice if we could get a bit of relief. Nobody's going to be sad when this is over, but I think that I can't overemphasize how tired they are. And in terms of just thinking it's almost over and then another surge and another variant and another angle to this whole pandemic comes up. We are trying to recruit. We have some vacancies that we're trying to recruit into. And we are working hard to do that because we know that the staff need the help and support to be fully staffed. So we're keeping on with that. And I think if we get a few more people into the system, it'll be a bit of a relief and they'll be able to take a bit of a breather and say, yes, we're working the way we should be now.
On that note, Vicki, you know, we're seeing these shortages of staff in the southern parts of Ontario and in larger centers. You know, obviously there are massive differences between what's happening there and what's happening here, but is there a concern of, you know, this loss of staff level because people are getting infected with Omicron? It's happening more readily now. Is there a concern from your perspective of losing staff, of having a massive shortage at some point?
Well, right now we have 22 staff who are off isolating because they are COVID positive. And that's a large number. I mean, we had 6 people call in sick one day across the system. And that's unusual for, you know, sick time calls that we're getting at this time of year. So yes, we're worried about it. We're keeping a very close eye on it. When we get staff, that one of the reasons why we've got Directive 2 right now is to enable us to be able to redeploy staff. So when we see that there are a large number of people calling in from a particular unit or across a site, then we're able to redeploy some of the staff to that site to help out. If we didn't have Directive 2, and I know it's not a very popular directive, and that's the one that reduces non-urgent and non-emergent surgeries and diagnostic imaging from being done. So we really are left just with urgent and emergent. That directive, though, does free up staff who would be busy doing that elective work that aren't busy doing that elective work now that we can redeploy. So that's what's keeping us afloat when we think about our staff calling in sick and being off, and we're managing. I think if we get a lot more staff who call in sick at various times, we will be stressed. But again, the staff here are tremendous. They pitch in, they work overtime, they do what they have to do to keep it safe. We also are bringing people back. So the nice thing is our staff who are off and are sick are getting better and they're able to come back to work. And that's one of the things that we see with Omicron. Yes, more people getting sick, but they're not as sick. So they can come back to work more quickly.
A massive thank you to all of your staff for continuing on with this, because really we wouldn't be where we are now in a better position without these staff working their butts off every day. So big thank you to all of them. And we look forward to chatting with you again, hopefully about some better news. But welcome to Muskoka, welcome to Mac, and look forward to talking to you again.
Thanks very much, James.
Thank you. And with that, we are going to take a quick break, but stay tuned. We do have more coming up.